Doctor, where are we on diagnosing, on having the proper test kits, the proper labs and correct diagnoses?
Very recently, new tests have been sent out to the state laboratories, and a decision has been made to allow certain clinical laboratories to develop tests that they can use to test patients also. So this will greatly expand our surveillance for the disease, and we will likely see an increase in cases just simply because we're finally able to test people that we possibly should have been testing weeks ago.
Now, how will it work, Doctor? Will there be enough of these testing kits? How long does it take to get a response on whether somebody is positive or not? And at that point, how long does it take to isolate that person and identify who they've been in contact with?
Well, I think the states are going to work out exactly how they want to do it. In particular, they want to make sure that all the laboratories in a given state are functioning in the same way. It wouldn't be great if one hospital tests in one way and another tests in another way. So I think there are still some details to work out. But what this should mean, previously there had been a several-day delay in terms of getting test results back, which was very hard for hospitals that had to isolate patients until they got a test result. This should mean that results are back much more quickly, possibly within hours.
Why is it taking so long? We've known about the coronavirus for a couple of weeks now. We've known that it'll spread rapidly, and we've also known that possibly up to 70% of the global population will get it eventually. So why is it taking authorities so long to put in place procedures that would at least try and keep it to a minimum?
Well, one of the challenges has been on the diagnostic side. The CDC, who developed the test, initially sent out test kits to state labs. In the quality control process that goes on, they discovered that there was a problem with those kits, so they had to remake them, and now are sending them out again. There was also a regulatory change to allow clinical labs to develop their own tests. So that's just been one of the challenges, just trying to figure out where the virus is and how much local transmission has been happening. And now that we are gaining insights, I think it'll be much faster that states will come up with plans for how to mitigate the spread of this. And by mitigate, I mean we're likely going to have a situation where our emphasis is to try to reduce the impacts of the virus and not fully stop it.
Exactly. Well, over the weekend we learned that there was a case actually in Rhode Island, which meant that it wasn't solely the West Coast that had it, and now we've learned that there's one in New York as well, somebody who'd come from Iran. So clearly this is now on both coasts at the very, very least. So Dr. Nuzzo, what should we do to protect ourselves right now the best we can?
Well, the most important thing is that if you're feeling ill and you think it's possible that you may have been exposed to the virus, I know that's going to be a hard thing to tell, particularly as we start learning about it circulating in our communities. But if you're feeling ill, it's really best that you isolate yourself at home. There's never really a need to go out when you're feeling sick. If you can possibly stay home, I think that's the most important thing that people can do. That will have the biggest impact in terms of reducing the amount of virus in our communities, but also the kinds of things that you would do to protect yourself from the flu. Washing your hands for at least 20 seconds, coughing into your sleeve instead of your hand, wiping down surfaces, particularly after people sneeze or cough. Those are the kinds of things that we do to protect ourselves against all sorts of respiratory virus, this one included.
If I am getting sick and I don't know whether it's flu or the coronavirus or maybe it's just in my head, right? Do I go to a hospital or do I stay away and hope that it just takes care of itself?
You should call your medical provider. If you're unable to reach one, I would try to get in touch with a health department or some other alternative medical provider like an urgent care. It wouldn't be great if people just started showing up at the emergency room. Those places are busy, first of all. You may not have the virus and you could be exposed to people who do, and it wouldn't be great if that's our first place to try to get care, because we really want to reserve hospital resources for the most seriously ill patients. So the best bet, I think, is to try to get in touch with a medical provider and to find out whether and how you should access care rather than just show up unannounced.
And on that note, briefly, Doctor, is there anything that I can do in order to get medicine? I mean, are there any medicines that are actually working?
Unfortunately, there are no specific medicines for this virus. The way that patients have been treated is with just supportive medical care. There are scientific studies ongoing to try to evaluate different medicines and compounds to see if they will work against this virus, but it's going to be some time before those become available.